The world is scrambling to stop the spread of COVID-19. More and more cases are popping up in countries far from the epicenter of the outbreak. Tonight, there are more than 85,000 confirmed cases around the world. More than 2,000 people have died, mostly in China. But the scare is how quickly cases are multiplying. At least 56 countries now have confirmed cases of COVID-19. Iran has the world's highest death toll outside of China, and cases spiked again today. In the U.S., the man in Washington state has died from the virus, prompting the governor to declare an emergency. Here in Canada, a woman in her 60s who traveled from Tehran to Vancouver has contracted the illness. There are 20 confirmed cases in our country, and as David Akin reports, right now, it's all about slowing the spread.
Morning. My name's Adrian Dix.
A Saturday morning press conference, a new confirmed case of COVID-19.
It's a significant situation. Obviously, there are Canadians now in Quebec, in Ontario, and in British Columbia who have tested positive.
And a common link to all the Canadian cases, the infected patients had recently traveled, often to Iran.
This demonstrates how the situation is evolving around the world, and now our response has to continue to evolve.
But in the United States, at least 4 cases have been confirmed with no travel connection. Evidence, authorities say, of person-to-person local transmission. And in Washington state, the first COVID-19 death. The Trump administration announced new travel restrictions on those coming from Iran and warned all Americans not to travel to certain parts of Italy or South Korea. New federal funds will also be made available to state and local health authorities for testing, containment, and treatment.
We've taken the most aggressive actions to confront the coronavirus. They are the most aggressive taken by any country.
But the president's claim is an arguable point. The province of Ontario, for example, has administered more tests than have been done in all of the United States. Same thing in BC, where 1,000 individuals have already been tested.
We test some individuals multiple times, so that's 1,425 tests, which is well over twice as many have been done in the entire United States.
Early and comprehensive testing is one of the key ways public health authorities can contain transmission of the disease.
It is a concern that they don't have the testing available in the States yet. It all has to be done in Atlanta.
Meanwhile, some frontline healthcare workers are pressing the Public Health Agency of Canada to improve the protocol used when assessing potential COVID-19 patients. They want to be issued respirators in addition to visors and surgical masks.
We need to talk about the precautionary principle, which is simple. When the science is not clear, we have to have the best protection.
Now, whether it's President Trump or Canada's chief public health officials, they all say the risk to public health remains low. But there is work being done in Canada and elsewhere to learn more about the virus, its incubation period, and how it gets transmitted from person to person. And that work is important to keep the risk low. Robin?
David Akin in Ottawa. Thanks, David.